Morning, everyone. Notes here. Saturday morning, about 8 o'clock, Mountain Time. Been up since about 6, had some coffee already, watching some news, stuff like that. Today I want to talk about this controversial shit going on with, you got these TV host doctors, Dr. Phil, Dr. Oz, Pinsky, whatever his name is, the shit that they're saying, this rhetoric, this total lack of empathy and caring for citizens of this country. I mean, these are doctors, right? They're not. Dr. Phil is technically not a doctor. He is not licensed to practice medicine. He has a degree in some form of psychology, and that's about it. He doesn't use it for practice. He doesn't practice medicine. So why on earth, of all people, would Dr. Phil be getting on Fox News or any news media show and talking about the medical aspects of this virus and pandemic? And with that, okay, Dr. Phil is sitting here comparing the deaths of automobile accidents, the deaths of people who smoke cigarettes, the deaths of people who are killed in domestic abuse and spousal abuse incidents, okay? He's talking about people who die in swimming pools per year, okay? And then trying to compare that statistically and comparing that to this pandemic of SARS-CoV-2 that has run rampant worldwide. You cannot compare the two. It's like apples and oranges, plain and simple. Because, see this cigarette? I choose to put this cigarette in my mouth and smoke it. I don't choose willingly to have coronavirus, COVID-19, SARS-CoV-2, whatever the hell you want to call it. I don't choose for that to come into my body. Dr. Phil, you're a fucking moron. Plain and simple. Anybody who backs Dr. Phil and this rhetoric and this apples and oranges statistic, you're a moron too. Plain and simple. All this does is just create more misinformation, more misleading information that people are going to attach onto, and the rhetoric that you're pushing out there is almost the same type of rhetoric that is coming out of the Trump administration about how this isn't so bad. This, the coronavirus is not that bad in retrospect, globally. Dr. Phil said, and I quote, "Loneliness will create more deaths than the virus itself." What? Man, I have been lonely and living a secluded life almost my whole entire life. I'm not dead yet. You talk nonsense, Dr. Phil. Stick to your show where you berate and put down little girls and teenage boys and stuff that think that they're cool and gangsta. I'll get you outside, all them motherfuckers. You keep doing what you doing on your show. Leave the fucking medical advice to the fucking medical professionals and the scientists. Huck. Alright, so I'm done with Dr. Phil. Jerk off. So, got another jerk off for you. Dr. Oz. Dr. Oz, what you had said about the trade-off of 2 to 3% mortality rate of American children going back to school? Nah, man. You're a jerk-off. Plain and simple. So, and I want to get it right. And then I'm going to put a little commentary to it. Alright? I'm going to get it right. I'm going to read it, quote, and direct from what Dr. Oz had said. Give me a second here. Let's see. So, Dr. Mehmet Oz said on the Sean Hannity show that reopening schools is a very appetizing opportunity. How on earth is opening schools an appetizing opportunity. Where are you getting an opportunity at? He then went on to say that these kids, need, proper education, safe education, food, things like that. I agree with that. I agree that all children, American children, children all over the globe, need to be offered a quality and a fruitful education, okay? I can give that to my kids at home. I don't need to send my children to a school with 3, 4, maybe 500 other kids, teachers, staff, and when there's no adequate testing, there's no antibiotic, there's no vaccine for what this is. No, I am not sending my kids back to school. I suggest to everybody, do not send your children back to school. I live with my wife who has cancer, my in-laws who have diabetes, respiratory problems to begin with. My brother-in-laws have respiratory problems and other underlying problems too. You really think that I, personally, am going to be stupid enough to send my children back to school just because it reopened? And then when they come home from school, I don't know what they're bringing back into the house. I don't want to have to put my kids in the shower and decontaminate them every time they come home. That's not a way to live. I don't want them coming home from school and being like, oh, you can't go hug grandma when you live with grandma. You can't go give grandpa a kiss when you live with grandpa. No, you cannot reopen schools. You cannot reopen businesses properly. Life as we know it is changed. And it will be changed until 3 things get done. Those 3 things are 100% adequate testing across the board, some form of an antibiotic, similar to that of like amoxicillin, penicillin, something like that, vulcramycin, something, right? Bactrin, something. And an adequate, viable vaccination that can be distributed worldwide. All right, back to jerk off Dr. Oz. So, one second here. I apologize, trying to read this. The screen's a little cracked. And here's the thing, too. Dr. Oz is a heart surgeon. Dr. Oz is not an epidemiologist. Dr. Oz is not a pulmonariologist. Dr. Oz is not a infectious disease specialist. He is a heart surgeon. Okay? I'm not gonna ask a cab driver if I need a new heart valve. I'm not gonna ask a doctor to give me a ride around Staten Island like a taxi cab would. Think about that. So, Dr. Oz says, quote, we need to get our mojo back. And during the outbreak, he mentioned schools, which are largely closed across the United States. Quote from Dr. Oz, I just saw a nice piece in The Lancet arguing that the opening of schools may only cost us 2 to 3% in terms of total mortality, he said. So, if we open up our schools and start sending all our kids back to school, you mean to tell me that there's a possibility that 2 to 3% of those children could become infected and die? And you think parents are going to be okay with that? Taking that chance? You know, I have twins, okay? I don't want one going to school and getting it and the other one being fine. Okay. So, he goes on to say, quote, you know, any life is a life lost. But to get every child back into school where they are being safely educated, being fed, and making the most out of their lives with the theoretical risk of the backside might be a trade-off to some folks would consider. I'm going to read that again. Quote from Dr. Oz, you know, any life is a life lost, but to get every child back into school where they are being safely educated, being fed, and making the most out of their lives with the theoretical risk of the backside might be a trade-off some folks would consider. I can safely educate my children at home. I can adequately feed my children at home. I can work with the school district in schooling them, testing them, making sure that they pass grades and pass to go to the next grade. Okay? a trade-off that some folks might consider? A trade-off. What is that? Okay, so there's no antibiotic, no vaccine, and no adequate testing. And you just want me to turn a blind eye to all that, send my children to school, and if something would happen to them and they would die or contract this, I'm supposed to sit there and go, it's a trade-off. At least the other 500 kids didn't get sick. No, fuck that, and fuck you, Dr. Oz. You put your children in those schools first before I do. You lead by example. You want to talk shit? You want to talk shit and lead by example on Fox News? Then lead by example and send your fucking kids to school first. And you know what? If your kids don't contract anything and your kids are fine, wholehearted apologies. But if your kids do get sick, die maybe, I'll laugh in your fucking face because you're a joke. You're a joke to sit here and talk about pandemic and a virus when you have 100% no qualifications except for the fact that you are a heart surgeon. Come on, man. So, Ozzy boy goes on to talk about, says, it's not clear exactly, this is not him, this is the article I'm reading. It's not clear exactly what he was trying to say. I get that too. If he meant that a certain number of deaths was worth the benefit of schools resuming, and his representative did not immediately offer clarification on Friday. That's what he's saying. It's okay if some children die to look at the masses. Thin the herd for the masses. And that's fucking appalling. Just because your last name is Oz, don't mean you can play like the guy behind the fucking curtain. Nothing to see here. Don't worry if people die. You're a jerk off, Dr. Oz. So, excuse me. Fucking allergies. So yeah, this is, it just, these two need to shut the fuck up, go jerk each other off in the fucking broom closet, and that's about it. Stop talking on the fucking news about shit you don't fucking know about. And another thing, only reason why you're pushing to get these schools open, okay, Dr. Oz, and then you got Dr. Phil, okay, back to Dr. Phil for a second. There's a graph that was pulled up with conjunction to what Dr. Phil was talking about, right? And I'm going to try to look it up right now and pop it up for you on the screen somehow. And the chart shows that it goes and shows the, you know, the line for the amount of car deaths, cigarette deaths, abuse, okay? It goes over a very little bit, coronavirus, red line, and it goes literally straight up. There is no way that this virus, or I'm saying, there's no way that loneliness is going to take more lives than this virus. One second. Come on, man. Da, 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 da. Da, 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 da. So, yeah. I mean, these guys, dude, stick to what the fuck you know how to do. You know? Jerk-offs. I can't fully pull this up at this moment. I have to find it somewhere. But, so, back to what I was saying about the rhetoric. The what is being said, okay? what is being said by these two individuals, okay? You got Oz over here talking about opening schools, okay? Trying to help push that Trump administration ideology and rhetoric through another form of media, through another outlet, okay? Dr. Oz has a very good following, very good TV show. I've watched it plenty of times in the past, okay? But this right here, what he said with this, about the trade-off and everything, you're a jerk-off for that, Dr. Oz, and you need to be held accountable for that. But, and that rhetoric is the same type of pushed rhetoric pushed down our throats off of Fox News and certain news media outlets, and it all stems from the Trump administration's ideology on economic levels, okay? The Trump administration and Trump himself feels that if we are not in a strong economic hold, that A, his re-election will go down the tubes, and B, we as a country will not be that economic superpower anymore. All right? I personally don't think we've been an economic superpower for a while, competing with China and other countries as well. But, and then you take Dr. Phil, okay? Downplaying the effects and outcomes of the coronavirus, COVID-19, SARS-CoV-2. I'm saying those three labels because I'm going to explain that in another interview after this, okay? What all those, how that goes, those words. But he's doing the same thing. Dr. Phil, now, Dr. Phil, around roughly 20 years, I don't know how long exactly, but I'd say about 20 years ago, he originally started on the Oprah Winfrey Show. And he had a great following through Oprah, thanks to Oprah. But back then, technically, legally, he wasn't a doctor. And in order for him to get his TV show and call it Dr. Phil, he had to get some form of a PhD, some form of a doctorate, something that would say that he, on paper, is a doctor, so that now he is not lying to the American people on this television show by saying Dr. Phil on there. Okay, so he does have a degree in a form of psychology. I have to look it up. I don't know exactly what it is. But like I said earlier in this video, he's not licensed to practice in any state. He's not licensed to practice anywhere. He just has the degree. And by having that degree, he now can have this TV show, which emboldens him to, well, now it emboldens him and enables him to say ignorant rhetoric against real-time news and real-time happenings. And he has that huge following. My wife loves him. My wife thinks that Dr. Phil's the smartest man in the world. And I joke with her all the time. I say, he ain't the smartest man in the world. I showed her what he said about this shit. I told her flat out, I said, hey, your boyfriend's a fucking moron. She said, who's my boyfriend? I said, Dr. fucking Phil, that dude's a fucking moron. Look at what he said. I told her everything. And she said, he ain't my boyfriend. Stop saying that. But, you know, millions of people watch that man. Millions of people watch Dr. Oz. And what they're doing, honestly, is fucking appalling. Because what you're doing is you're spewing some garbage Trump administration rhetoric to have your channel of viewers, your channel of followers and stuff, to kind of, you're trying to sway them. I know what you're doing, people. Phil, Oz, you're trying to sway your supporters, your viewers, into believing and thinking what you think, which then in turn, it has that Trump administration rhetoric to it. It has that Trump administration ideology to it. Vicious fucking circle. And my personal opinion, Dr. Phil and Dr. Oz, you need to shut the fuck up, stay the fuck home, quarantine yourselves, and stop talking on the fucking TV about shit you don't fucking know about. Trade off my kids' lives? Fuck you. Fuck you. And that goes for anybody that thinks that I should put my children in a school and take the chance. And it is like putting your children into a no-win situation. It is like putting your own children into a line and leading them to a slaughter like sheep. schools without adequate testing, without a viable antibiotic, and without quality and viable vaccination, we should not at all open schools by all means. At all. Schools should not be open at all. We need to work on mandating, maybe putting together on a federal level, a schooling program, online schooling program on a federal level, working with each and every individual school in this country, because children must come first. What did I say? Children are our future, right? And that's the fucking truth. So why would you sit there and try to say, it's okay if only 2 to 3% mortality rate? No. Like I said before, you put your children in the school first. We'll see what happens, okay? But I know I'm not putting my kids in the school. I will wholeheartedly do everything that I can to homeschool my children at home, working with the school district here. And that my kids would not set foot in a school ever again if those three things, testing, antibiotic, and vaccination, those three things do not happen, or if it takes 2 years or 6 months or 3 years, my kids will not go to school for that duration of time. They will not set foot in a school. They will have schooling, but they will not set foot in a school until those three things are met. And that is something that I stand by. And I think every American should stand by that. That's just my opinion. Man, I'm a little heated this morning about this. Bullshit. It is. Alright, so I've been on this thing for like 22 minutes now. So, yeah, I'm going to go right now. I'm going to start to do another video. Talk about differences in the terminology of coronavirus, COVID-19, SARS, SARS-CoV-2. I'll blow your mind right quick. Yeah. Anybody out there that is interested in helping any healthcare workers, doctors, nurses who are working on those front lines, they are our heroes right now. Heroes don't wear capes at this point. Heroes wear smocks, masks, and gloves. And I salute every single one of our healthcare workers working on the front lines. I salute every one of our food delivery drivers that are out there risking what they're doing to help feed Americans around the country. If you want to donate anything to help the nurses and doctors on the front lines, go to redcross.org. Redcross.org, accepting donations. They are putting the money together to get food and PPE for these healthcare workers that are in the hotspot zones. You know, New York, of course, New Jersey, Pennsylvania, Philadelphia area, Detroit, Michigan, down in major cities in Louisiana, San Francisco, up in Washington State, Seattle, just, here in New Mexico, for instance, we got, I don't know the exact numbers, we have like a little over 1,000 cases, I believe. Almost 800 of them come from the Native American Navajo Nation. Where is our government? Where is our federal government to help these individuals? Why is there so much bickering back and forth? Horrible. And now you can really kind of see a true, in 2020, it's 2020. I wouldn't expect to see the type of ignorance and racism and bigotry that is going on with this pandemic. We as human beings, right now, of all times, we need to work together, not divided and bickering back and forth, presidents, governors, this and that. It's as if, you got African Americans going to want to get tested. They feel they have symptoms. They want to go get tested, this and that, being denied. Being denied because they have lack of insurance or income or something, but yet the white people are getting tested. Not cool. That is not cool at all. Look at what I was just saying about the Navajo Nation. They're doing nothing out there for these people. These people, you have some of them that are, veterans. Where do you think the code talkers came out of when, during World War II, the individuals who broke the codes that Japan was sending, Native Americans did that from right here, New Mexico, Arizona. And after the war, a good majority of them come back here, the ones that didn't pass away in war. And now we're just going to turn our backs on them? These are people that are in their 80s, 90s, almost 100 years old and whatnot. And our federal government is just turning their backs on people that have fought, sacrificed for our freedom. It's appalling. I can't stop saying the word appalling. It's all appalling. All of this. All of it is appalling. I'm rambling. But yeah, redcross.org. If you want to donate anything, go to redcross.org and donate. And like I said, donations will be carried out to these medical workers on the front lines. It'll be used for, like I said, PPE, gowns, masks, gloves, face shields, food, possibly like housing for hotels, stuff like that. Redcross.org is doing an incredible job with what they are doing. And I commend them. That's why I'm helping to push it on here. We all need to do our part somehow, some way. Yeah, that's how I believe too. This is not a time to split hairs. This is not a time to, have sides, animosities, and things like that. This is a time when we, as a human race, must stand together. We cannot lie to each other. We cannot hide each other. Sorry about that. We cannot hide information from each other. We cannot lie to each other and give misinformation and things like that. This is not going to help us in the long run. We as a human race must work together as one cohesive entity to defeat and get over this pandemic. Alright, remember, redcross.org, make a donation, help out those healthcare workers on the front line. Sorry if I was a little too emotional with this video, but you start talking about children, and I got twins, 7-year-old twins. It hit a nerve in my heart, Dr. Phil, Dr. Oz mainly. You're a piece of dirt, Dr. Oz, to say that. I'm not saying you're a piece of dirt all the time. Like I said, I've watched your shows. But, yeah, you're a piece of dirt for saying that. And like I said, you send your kids to school first and lead by example. You want to talk shit like that? Lead by example, motherfucker. Plain and simple. So, alright. Notes out. Remember, redcross.org. Donate. Help the frontline workers. This is a war. And our soldiers right now are nurses and doctors with gloves and masks. Not soldiers in fatigues with guns. We need to realize who is really fighting for us right now. redcross.org. If you can, please go donate. Thank you all for watching this video. I hope you all have a great day. Stay safe. Wash your hands. Don't touch your face like I'm doing. I'm about to go wash my hands right now, actually, and do another video. But everybody have a great day. And please, if you can, subscribe, share videos, give me some feedback. I want any and all feedback. I apologize for doing this in the shed today. I kind of actually like it in here. I might kind of clean it up and put a backdrop or something for me. It's quiet out here. But yeah, I do apologize for the junk and stuff in the back. But yeah, stay safe. Wash your hands. Remember, practice social distancing. And please, take this advice. When you walk into your homes, if you go shopping, take your shoes off. Leave them outside or spray the bottoms down. If somebody is coughing and they're not wearing a mask, or they sneeze and they're not wearing a mask, and that goes down onto the floor, especially on a floor like a Walmart floor or a supermarket floor that is, linoleum, or, it's like really smooth, it will live on that surface. You step on that with your shoe, you now track it into your car, you track it into your house, and this is another way you're going to get it. And That's proven. CDC has talked about that multiple times. Please remember, wash your shoes, spray your bottoms of your shoes down, and remember, redcross.org. Okay, make a donation, help out our heroes on the front line. Okay, finally, notes out.